Hello, my name is Annette Ortiz, and I will be talking about my demonstration speech for today. I chose something that I do on a daily basis when I'm at work, which is phlebotomy, also known as blood draws. Did you know that approximately 70% of medical decisions are based on laboratory testing, which means getting your blood drawn? Drawing blood is an essential part of a diagnosis and treatment for various illnesses and diseases. If you have ever wondered what goes on behind the scenes, I'm going to show you a little bit today, step by step. This is the most common and most important medical procedure. This is the first procedure that happens when you come in through the door, whether it's seeing your doctor first and chatting with them, they'll have you follow up with blood work. If you come into the ER, we will have you do blood work and a urine sample. This is standard first step in most medical procedures. Before we get started, I will give you a little background on this topic. Drawing blood is a crucial medical procedure and an important part of healthcare to assess the patient for diagnosis, monitoring, and any type of treatment. This procedure provides valuable information about a person's overall health. Everything starts with a blood draw. Basic blood tests always include checking our cell count, cholesterol levels, and any kinds of infection. Steps for blood draw. So step one is gathering the blood tests that are ordered from a computer system or paper requisition that is given to the patient. So the biggest site that's used in healthcare is Epic. So basically you'll come into the laboratory for your blood test, they'll ask you your name, they'll go ahead and print any lab work that needs to be done, and it will give you labels. Obviously, these are not the labels, but the labels are the same. It's typically the patient's name, the sex, today's date, and their date of birth, and this is something that they will verify and make sure that it's done. We'll gather all the materials that we need for the patient, including all the necessary supplies, which we're going to use a butterfly needle today. The gauge on this is a 23 gauge. The bigger the number, the smaller the bevel, and the bevel is the needle. We have tests, check for your high cholesterol, basic metabolic panel, a complete blood count, which is the cells that I mentioned, and a clotting factor, which is a PT-INR. We'll also use gauze, alcohol, a Band-Aid for after, a tourniquet, which is going to help us find the vein that we're going to use, and gloves to be sanitary. The third step is to locate the vein by applying the tourniquet, typically about 3 to 4 inches from the intended puncture site. So, for example, on the front of her hand here, if I were to put the tourniquet on her, we're going to go higher than where we're going to go. By the way, the special guest is my daughter. And as you can see here, make a fist. This here, she has 1 and 2 veins. So if I were to draw her right here, I'm about the 3 to 4 inches up that I need to be. If I decide that I want to go to the bend of the arm, which is here, I will come right up here where her t-shirt is and apply the tourniquet. And it will still ask her to make a fist so I can locate the vein. On this arm here, she has 1 here. Let's see if I can bring it a little closer just for this part. Pull them out. Okay, so we will pick 1 or 2 of whichever vein. She has 1 here. She has 1 here. Okay. We'll clean the site that we're going to puncture, whichever one we chose, whether it was going to be a hand draw or an arm draw. And we'll go ahead and use the alcohol at that point, clean in a circular motion without re-wiping the area that we took the germs off to begin with. We'll insert the needle at a 15 to 30 degree angle for a quick, smooth motion. Step 5, we will collect blood through that syringe, which we'll show you at the end. Through this syringe, it'll come out. And right here, this will go connected into here, and I'll just pop in each tube that I want to draw. We're not going to use all of these on her because we're not going to keep this blood to use it for anything. So I don't want to take a lot out of her that I don't need to do. 6, we'll then remove the needle, apply pressure with the gauze that we talked about. And then we'll go ahead and put a Band-Aid on once we are done. Once we're sure and we're done that she is no longer bleeding. So in conclusion to today's demonstration speech, drawing blood is a fundamental part of the healthcare system that allows us medical professionals to gather important information about the patient's health. By following these steps and even going to a phlebotomy course that is not offered to everyone, this is a job in the medical profession with a certificate, of course, that you can perform and start your journey in the healthcare industry if you wanted to, the way that I did. Remember, blood draws are essential for diagnosing diseases, monitoring your treatments, and promoting overall health. Thank you for learning how to draw blood with me, and I'll go ahead and show you the demonstration now. You want it in your hand or you want it?
Which one is easier?
Oh, this is little and they can probably see it better. And then yeah, I think that's a perfect angle. Make a fist. One swipe or in a circular motion, whatever you prefer. We do go ahead and let that dry. Then this is the bevel, the 23 gauge I spoke about. It's a very small needle. This button will contract the needle out of her arm once I'm done, and that's just for assurance that I don't get poked by her and she doesn't get further poked after we're done with the procedure. Okay. Take a deep breath in. That's it. The needle is in, and then if this were the real medical field, I'd fill all of those up, but I will only fill a little bit here today. We're going to cover the top of the needle, hit the button, apply pressure. This is our sample. We will remove the tourniquet. We will lift and see that she is no longer bleeding. We will leave the gauze here. Take our bandage. Apply the bandage and keep a little bit more pressure for a few seconds, typically 20 seconds, 25 seconds. If you see that the patient is still bleeding, I would obviously continue to apply some pressure. And that's it. I've demonstrated to you how to draw blood and what I do at work daily. Thank you for watching.